Today, I prepare some juicy food for your blood vessel. There are good veggies and dessert. We can eat for meals. I brought you the best food to lower blood pressure with much scientific evidence. No time to chat, so let's take a look. Beet. Beetroot is a powerful nitrate supplement that might help to control blood pressure, even for those who are diagnosed and treated with drugs. The beetroot juice may lower blood pressure and may reduce any kind of cardiovascular disease. There is a study on 30 healthy men and women, which is the double-blind, randomized, placebo-controlled crossover study. Volunteers received 500 grams of beetroot and used a blood pressure monitor system. There was a trend to lower systolic blood pressure after drinking beetroot juice. About 4 to 5 millimeters of mercury reduction showed in systolic blood pressure. Beetroot juice or beet supplement might reduce blood pressure, probably through nitrate. Beets have highly concentrated nitrate. When nitrates go into the digestive system, they turn into nitric oxide, NO. Nitric oxide reaches blood vessels and relaxes them. Widen blood vessels, lower pressure. Beets are also a betalain, natural pigment, which has anti-inflammatory, antioxidant, immunomodulatory, and anti-cancer activity. If you have a history of a kidney stone, eating beet must be cooked due to high oxalate content. Beets are easily found and very cheap. Drinking just 1 cup of beetroot juice decreases the risk of hypertension and other cardiovascular events. Tomato. Vegetables such as tomato and its component, lycopene, have been evaluated in lowering blood pressure. The exact mechanisms are not fully understood, but the antioxidant properties of lycopene are believed to play a role. Dietary lycopene is a carotenoid compound associated with a lower risk of cardiovascular disease. The lycopene is a powerful antioxidant and lowers total cholesterol levels, maintaining healthy blood vessels. It may enhance the production of nitric oxide and improve endothelial function, which leads to lower blood pressure. Some studies suggest lycopene may have an inhibitory effect on angiotensin converting enzyme, ACE, which play a role in regulating blood pressure. Whole tomato also contain lots of fiber, which reduce the absorption of bad lipids and minerals to regulate blood pressures. One of the clinical trials with the standardized tomato extract significantly decreased systolic blood pressure compared to the placebo, with a 6 millimeter of mercury decreased. Berries. Everyone loves berries, and your blood vessel also loves berries. There are many berries we can use to lower blood pressure: blueberry, beerberry, cranberry, raspberry, strawberry, and so on. The relationship between hypertension and dietary berries has been proven with clinical evidence in recent years. Contribute to berries polyphenols like anthocyanin. Berries have the potential to treat or prevent hypertension. Polyphenols are plant secondary metabolites, including phenolic acid, flavonoid, stirberin, and lignans. These have excellent antioxidant, anti-inflammatory, and vascular protective effect to prevent cardiovascular disease. Within berries, 3 classes of polyphenols in particular may account for a beneficial effect on blood pressure: anthocyanin, condensed tannin, and ellagic acid. The anthocyanins involved increasing nitric oxide to relax blood vessels. More effectively, it helps to lower blood pressure by decreasing the synthesis of anthocyanin-1, cyclooxygenase, and angiotensin converting enzyme, which are all related to hypertension. Tannins are condensed in berry. They are also known as proanthocyanidin and can be changed into anthocyanidin in acidic conditions. Blueberries and cranberries are major sources of tannins, and several studies have shown therapeutic effect on high blood pressure. Through inhibition of the ACE pathway, a randomized study reported a significant decrease in blood pressure in pre-hypertensive subjects after consuming 400 milligrams of pro-anthocyanidin extract daily for 12 weeks. Ellagic acid in berries have a similar structure as the hypertension medicine, captopril. Like captopril, ellagic acid can block the active site of ACE and lower blood pressure. Yogurt. Yogurt is often considered a healthy food that may have benefits for hypertension. Yogurt is rich in calcium and potassium, both minerals that regulate blood pressure. Potassium helps balance sodium in the body, and calcium play a role in smooth muscle contraction, including muscles of blood vessels. Probiotics in yogurt are also important to lower blood pressure. Healthy gut microbiota contributed by yogurt probiotics linked to blood pressure regulation. These probiotics reduce inflammation and improve function of the blood vessel. A low sodium rate in yogurt is crucial to hypertension. Reducing sodium intake by consuming yogurt or through DASH diet is also very effective in preventing and treating hypertension. A large scale of study on yogurt for approximately 2,200 adults for 15 years find that people who take yogurt have 30% less risk of hypertension than those who do not. In other study of yogurt on 3 large scales, higher yogurt consumption was linked to 16% lower high blood pressure risk compared with other dairy. Combination with the DASH diet is recommended for more effective lowering of blood pressure. The question is how the yogurt reduces blood pressure. Dairy food, including yogurt, is involved in the vascular system, increasing nitric oxide and deactivating the ACE enzyme. The nervous system and certain glia in the brain might be affected by dairy-rich food. And in digestion, altered gut structure, microbiota dysbiosis, and the cholecytokinin system might be linked to the lowering of blood pressure. All of this evidence shows dairy food could help prevent hypertension. What we know currently is that yogurt is the most powerful food to reduce blood pressure among these various dairy. Dark chocolate. Dark chocolate is a good way to lower your high blood pressure. Like berries, cacao contains high concentration of polyphenols. Polyphenols, particularly flavonols in cacao products, have been shown to increase the formation of endothelial nitric oxide, which promote vasodilation and consequently may lower blood pressure. Dark chocolate is rich in antioxidants, including flavonoid, which can help neutralize free radicals in the body. By reducing oxidative stress, dark chocolate may support overall cardiovascular health. This astonishing cacao product is interesting as an alternative treatment option for hypertension.